The Daily Mirror today launches campaign to give all the brave NHS staff and volunteers helping to battle the coronavirus medal. Hundreds of thousands of doctors, nurses and healthcare assistants are treating patients hit by COVID-19, and we believe they deserve an honor. The public has already showed gratitude by standing on doorsteps and windows across the land to give huge round of applause on Thursday night. The gesture, which many workers said moved them to tears, came as they shared images of themselves and told of their struggles amid the crisis. As they work grueling hours, many lack basic protective gear, and they sacrifice time with their own families to look after ours. Backing our campaign, former Health Secretary Jeremy Hunt, who chairs the Health Select Committee, said, "A medal is the least we can do for our NHS heroes fighting the coronavirus war." Labour leader Jeremy Corbyn said, "Our NHS workers and volunteers are true heroes. At time of crisis, it's been source of strength for us all to know so many NHS workers and volunteers are working tirelessly to protect us. That's why I was eager to join people around the country clapping for the NHS and our carers on Thursday night. We owe our deepest thanks and solidarity to our healthcare workers, so I'm delighted to support the Mirror's great campaign to give medal to NHS staff and volunteers. It is our health and social care staff and volunteers and our cleaners, refuse collectors, delivery drivers and so many others who are too often forgotten, who will see us through this crisis." British Medical Association Council Chair Dr. Chand Nagpal said, "All NHS and care staff are already going above and beyond. As we face this pandemic, their dedication will increase immeasurably. It is only right that we recognize the heroic efforts during this unprecedented and frightening time." And Dave Prentice, General Secretary of Union Unison, said, "On Thursday night the whole country showed its love and respect for the NHS and its wonderful staff. Unison is proud to get behind the Mirror's campaign. Health and care staff are working tirelessly in challenging conditions to care for us all and save lives. We salute them all." There is precedent for granting medal after the government approved Gong in 2015 for Brits helping with the Ebola outbreak in Africa, the first medal given for humanitarian crisis response. Acting Lib Dem leader Sir Ed Davey said, "The scenes of millions clapping their thanks for NHS and care workers on Thursday was really uplifting. It was fitting tribute to the heroes at the front line of the fight against the coronavirus. They all deserve medal, and they should get medal. In the coronavirus fight, they are the few looking after the many, and Liberal Democrats will do all we can to be voice for these key workers in Parliament." Plaid Cymru leader Adam Price said, "The heroes of this generation are on our front line in the health and care service fighting this disease day in, day out. These heroes might not wear capes, but they are saving thousands of lives every single day. When opened my door and heard the clapping on Thursday night, heard community coming together to thank them. Once this war against the coronavirus is won, we can again show them our gratitude with the Mirror's Medal campaign." And business leaders also backed our call. CBI Deputy Director, General Josh Hardy said the NHS heroes deserve all the recognition we can give them. Meanwhile, their eyes are heavy and the red marks around their faces are prominent. From doctors and nurses, to paramedics, care home workers, and porters, these are the many faces of NHS heroes fighting coronavirus on the front lines. Here, they reveal the toll the pandemic is taking on them but why they won't stop. Maria Lizcano Gomez, nurse at Royal Brompton Hospital, London. "I am being sent to other wards as adult intensive care to look after ventilated COVID patients as have course and experience in intensive care. It's only been 13 hours shift. My first 13 hours. My colleagues have been there for longer than me. Our noses and cheeks are really sore and red. Our faces and hands become really dry and itchy as the day passes and we get really tired of being under layers of protective gowns and gloves. And this was just my first day. I don't want to be dramatic but this is getting real and it's really bad. So please, please, take it seriously. If government announced lockdown, it is not for you to go out for a walk and have picnic in the park. They may have to close parks, so now can't even take my dog outside. Who's been waiting for me 13 hours? Sooner rather than later we will run out of equipment and materials, leaving us in the hard situation of choosing who will survive and who won't. So please, stay home and don't let me be your nurse. It's really simple. And wash your hands. Barry Lamb, night porter at Salford Royal Hospital. I am not university-educated doctor, but I'm there and see it all. My job is to push COVID patients from ward to ward and in way, am also putting my life on the line. It's job cherish and am made up can help in the smallest way possible. I've done 11 days straight and this weekend, when I'm due to be off for my birthday, will be at work. It's my daughter's birthday as well. She will be 15 and me 51. And it's soul destroying to have to stay away from her, but it's the right thing to do because I'm such high risk. The staff work with at the hospital are like second family to me and am proud to stand with them through this. But for all our sakes, please, listen to the advice to stay at home and do your bit too. Dr. Samar Mahmood, GP, Barnsley, South York's my colleagues and have transformed the way we run the GP surgery. Our reception staff have been dealing with huge volumes of phone calls and GPs are adapting to new form of consulting, now 100% over the phone. In the last week or so demand has started dropping and that fits in with how more and more people are hopefully understanding the advice bit. Weeks. This is not just flu. It's not simple viral illness. It's killer infection and we don't understand much about it at the moment. We're still learning from the people infected and who have died. It's better to be overcautious, even if somebody is young and healthy. We've started to see young people who are well and dying from this. It's not just about ourselves. The risk is the harm you cause to other people. Better and not coming to the surgery or seeking appointments unnecessarily. But the feeling amongst my colleagues and as we're worried this is the calm before the storm. At the moment we're unfortunately having an increased number of cases and, sadly, deaths every day, but it is manageable and somewhat stable. But we're worried over the next 2 weeks it could get lot worse. We can work within general practice, but there's lot of doubt over what could happen in the next 2. If you carry it and pass it on to vulnerable person, you could end up killing somebody or even yourself. It's extreme language but it's not sensationalizing it. This is very real. Orsalia Amidou, care home nurse in London. We are the ones who care for your parents or grandparents, the most vulnerable people in this whole pandemic. We come to work anxiously, fearing that we will infect them, and even though we wash our hands 1,000 times a day, we cannot do social distancing, because we have to feed, wash and give medication to these people. And yet we do not have any proper PPE. We want to keep the people we care for safe and coronavirus free, but we have to live with the fact that we might not be able to protect them and we feel abandoned in this situation. Do not forget us. We are many. And we cannot stay at home either. Charlotte Hicks, nurse, Colwall, Herefordshire. I write this with tears. This really is no joke. Have never felt more alone. Later today kiss my boys goodbye until isolation is over. As their mum, have taken the toughest decision but the best one. For them to be in isolation away from me, whilst go back to work and kick COVID-19 out of here. The boys know that can't tell them for certain how long this will be for, but they also know that their mum is going to be helping poorly people with coronavirus. As nurses and doctors within the NHS, as scared as we all are, we signed up for this, and will nurse all patients regardless of whether they have this virus or not. Together we will do this. To my boys, know that love you, and there are days when I'm going to sit here alone crying because miss you so much. Daniel Milosevic, paramedic with the Welsh Ambulance Service, Gwent. As things are right now, being on the front line of the NHS is tough. Stress levels are high and we start every shift with no idea what we might be faced with. The PPE we have is there to keep us as protected as possible, but it's no fun to work on tough jobs. Like cardiac arrest, we need to be wearing the full works, respirator mask, visor, full body suit with hood, gloves and boot covers. Trying to resuscitate someone is very physical and can easily last an hour and a half, sometimes longer. Just imagine doing full body gym workout in your living room for an hour and a half, while completely wrapped up in kit that, by its nature, is unfortunately not breathable. I'm sure it's becoming obvious that we're working hard, as is everyone within the NHS and other key workers who keep the country turning. But unfortunately we're still getting called to worried people who may have mild symptoms and want check over or believe we can come out and test them at home for their convenience. While we and other key workers put ourselves at risk by going to work every day, everyone else just has one job: be sensible, follow the advice and stay at home. Ailsa Atkinson, theatre nurse, York, have been moved to ICU with some colleagues to help with the response to COVID-19, and today was my first shift helping out on COVID intensive care. I have massive respect for the nurses who work in ICU all the time. It isn't easy, especially in full PPE. To anyone who still isn't taking it seriously and thinks that the lockdown is over the top, it's not. You might not get as poorly as these people in ICU, but someone you come into contact with could. Please don't be selfish. Enjoy spending more time with your family. Stay at home. Stay safe. Lucy Hutchings, healthcare assistant, Southampton, hears me straight from 13-hour shift. No makeup. No filters. Nothing but realness. I wish could stay home with my family, watch movies, eat food, but can't because spend 13 hours day working for the NHS. So when see people are not taking it seriously and think this is all joke. Staying home is privilege, and it is not impossible. For people saying that what Boris Johnson has done is pathetic, it's not. It's for the best. He's trying to protect you all as well as keeping you out of the hospital with other COVID patients. You think, oh, won't get it all be fine, but it's not fine. It's killing hundreds of people every day, and beds are quickly being taken in the COVID-19 wards. This is real life, and watching people in pain and suffer is devastating. Working on the COVID wards really opens your eyes to a whole different spectrum. It's mentally and physically draining. This is real. This is not joke. Everyone needs to take what's being said seriously. I have my happy days, and today is my sad day. I'm so lucky to have such an amazing and supportive group of staff at the NHS to help work through this, and we will beat this virus. The quicker you stay home, the quicker you can leave. Help the NHS. Stay home. Stay safe and look after your family. Georgia Homer, staff nurse, Cambridge. Unfortunately we have not hit our peak yet. The lockdown will help lot to slow it down. But our number of cases are on par with Italy. This is why it is so important to listen to our government and continue with strict lockdown. I know it's shame we have gone into lockdown in such nice weather, but it had to be done, and people do need to listen. Cannot express the importance of this. The government haven't asked for everyone fight on the front line like our ancestors. We're not expecting you to fight battles. All we are asking is that you put your feet up, relax, enjoy time with the family or friends you already live with. Play board games. Have an indoor spa day. We're not asking for a lot. It's important to go out for a brief walk for our physical and mental health. Get some fresh air and some exercise. But other than this, please stay indoors. I was quite naive at the beginning. Everybody was. Now it's hit home that it isn't just affecting the elderly and people with underlying conditions. It's affecting young people too. I've cared for them on the wards and seen the true effects of this virus. This virus spreads like wildfire. People aren't realizing this. COVID needs to be taken seriously. It doesn't care who you are, how old you are, or if you have children. The NHS is relying on you. Please listen to the government and stay at home. The world's scary place for us right now, but we're trying to fight this together. Cam Williams, with colleagues Verity and Jordan, paramedics, Staffordshire. Working on the front line of this pandemic is scary, frustrating and exhausting. The pressures of the pandemic and what we witness are more frustrating than anything. We are dealing with our normal day-to-day service with added pressures of the pandemic on top of this. The frustration comes from seeing people on numerous occasions not taking the advice seriously. They are carrying on life as if it's normal for them and treating what's going on as if it's an extended bank holiday weekend. That is the biggest problem. People are dying from this disease daily, with increasing numbers. We risk being one of those people. We go to work every day with the fear that one of us might not come home. Ilaria Taberi, intensive care nurse. London. I wanted to try to explain what feels like being an ITU nurse in this moment. But I'm honestly too tired. Have no energy left. These shifts are probably the worst we all had in our lives. You people out there don't realize how tragic and dangerous this situation is. So please be careful. And help us take care of you. Danny Hughes, paramedic. Newhaven, East Sussex. I've moved into my campervan so don't infect my family. One member of my household while was away became symptomatic and, given the state of how busy we are, didn't think that sitting at home for 2 weeks would be the best use of my time. I thought it was more advantageous to isolate myself temporarily. We come into contact with patients who potentially have the coronavirus on daily basis, whether that is the potential to have it or those who are confirmed as having COVID-19. I wanted to put that step forward and protect my family. May not have symptoms, but there is nothing to say won't pass it on to my family. Sarah Campbell, community healthcare worker. Carmarthen. We're trying to keep everyone safe and alive. It's not been too bad at the moment, but think it's going to kick up in couple of weeks. We only work 4 or 5 days week, but I've volunteered to pick up as many extra shifts as can. But it is frustrating to see people going out and exposing themselves voluntarily. It is quite incredible that people aren't taking this chance to catch up on Netflix or read books. At the weekend everywhere was heaving, everyone was mingling in the sunshine. It was ridiculous and it's heartbreaking to see. So please stay home. It's killing people, even the young aren't safe anymore. I'm having to distance myself from my partner, my best friends, everyone. So please, do your bit too and stay home. How to thank the NHS. The Daily Mirror is proud to be part of the NHS Heroes campaign. We invite you to show them love by helping us create living map of gratitude. By dropping heart on the map, you're saying you appreciate the efforts NHS staff make.